So what is
So today's commercial is brought to you by Mounds. Dark chocolate, coconut, very smooth taste, very delicious. But seriously though, take it, beauties. No, that wasn't no free advertisement. Get the fuck out of here.
So everybody, today's video, if you've been...
It's seriously brought to you by Pepsi, the thirst quencher. Very delicious, nice and crisp. All the caffeine you need. Okay, go ahead. Seriously though.
All right, so if you guys been following us on Facebook,
You know today's video is brought to you by Life Water. Go ahead.
Today's video is gonna be brought to you by
By
Snap.
Krispy Kreme pies. Because
Damn pie.
nah, but really though, that's no free marketing.
We ain't
No
getting
free
paid.
advertising.
We ain't getting paid,
No free advertising.
but we ain't getting paid.
Exactly. That's why it's not free.
It's very free because ain't nobody paying us to do it.
Exactly.
So, with that being said, if you've been following us on Facebook and Instagram, you probably been seeing posts of me being in the hospital, and I've been hashtag story timing it. Well, today is the day that I'm finally getting around to explaining why I got this and like a couple of other ones that have ripped off. So, where do I start?
From the beginning.
I'm sick, y'all. So basically, I don't really remember kid per se, but you know, according to my family, I've always had this thing with vomiting, and the doctors really never knew why, but it would just happen at random times. Like I could be outside playing with friends and just being extra hyped and, you know, being, you know, extra happy as a child would be, and then I would just So, I guess we could say it started off as a child and the doctors just really didn't know what it was. And then as I got into like my adulthood, let's say like my 20s, it really started to become like a serious problem once I actually started dating James. Like, not to say that it wasn't bad before, but it just wasn't to this level where it had me in and out of the hospital.
Like she was eating McDonald's every day. Yeah, that was a shot at McDonald's.
Right. So, like I said, it wasn't as bad until I got into my relationship with James, and then that's when I found myself going
and just decided to be sick on purpose because fuck me, that's right.
And then I just found myself in and out of the hospital. So I guess I'll start off with like what some of my symptoms are: vomiting, heartburn, chest pain, stomach pain, and it might be TMI for some of y'all, but constipation. I don't go poo-poo like everybody else. Like I can literally go like 2 to 3 weeks without doing it.
Hold on now, goddamn! I knew you was backed up, but that's backed up. You pretty much was on vacation from shitting. Like your intestines went AWOL. Them bitches left. They was literally like, fuck this shit.
I get a lot of like throat sores. Like a lot of throat.
No, that's not my fault. Those of you with a bad imagination. That's not my fault. I mean, I don't give her throat sores, but it's my fault. Her throat is sore sometimes.
No, it ain't. No, it ain't. Don't hype yourself up.
I'm too hyped. I'm already hyped, nigga. Too hyped.
So
I'm too gangster for this video.
So those are some of my symptoms. Pretty much what it is that my digestive system does not work properly, and at one point my esophagus was very inflamed and very much infected, but as of recently we discovered that my esophagus is no longer inflamed or infected. what it is that I have hiatal hernia. And what hiatal hernia is that my stomach decides it doesn't want to stay the fuck still. It wants to move up my esophagus. So the esophagus is where the food goes down. So your food goes down and there's a little hole and your stomach is too big for that hole, but it wants to force itself in there, basically crushing the esophagus and blocking any food that can come from the esophagus, which will then have the stomach acid going up the esophagus where the stomach acid should not be going, and it basically causes me pain, and then I throw up, and then I get sick, and I get the chills, and I get tired because it takes a lot of energy, because there's times where
it's like her body is trying to throw up her stomach.
Like, I basically will spend like a whole hour and 30 minutes just vomiting. Sometimes, if I can't make it to the bathroom by our bedside,
I have plastic bags galore.
I have like 3 plastic bags.
Literally, we have a drawer of plastic bags.
We do. So, pretty much that's like one of the reasons why like posting YouTube videos may not be frequent. We really want to give you guys daily content. We do. We try to throw out like 2 to 3 videos every time we are together and every time I'm feeling good, because it does take a lot out of me on top of me working all my jobs.
In my perspective, well, from the way I see the situation, I don't like seeing her like that, because okay, on a good night, the most that'll happen is she'll get tired from throwing up on a good night. But sometimes, even after throwing up, she'll just say, James, even though I threw up, sometimes it's like she becomes incoherent, like you've had too much to drink, you know? Like she'll sound dizzy or something. James, Eudice, what are you trying to say? Well, I don't know. And then doze off to sleep or something. So, and then not remember the conversation we had.
Yeah, I really don't remember a lot of things when I get like that. And then because of it, like things that get affected is my sleep. So that's like another reason that we might not post a lot. Like if you don't see us posting a lot, it's probably because like not only am I sick,
she gets exhausted.
I am running on like 2 hours of sleep, sometimes 3 hours of sleep. How do I know this? I keep track with my Fitbit. Team Fitbit out here. So yeah, I'll have like 2-3 hours of sleep. I mean, I guess like on a good night we're probably looking at 4 hours of sleep. I'm sorry if I got all up in the camera. I'm looking at Panda because Panda want to be hard-headed today.
But if I lay down with her and I rock her to sleep, she'll get about a good 5 to 6 hours. Then we wake up in the morning and I start my nonsense.
He really does. He really does. Just irritates the crap out of me. So.
But that's not true, because as you guys just heard, there's no crap to irritate out. If only it came out that smooth. That smells pretty good. What is this?
Give me my spray bottle.
I mean, I just know.
So.
Well, fuck. You okay?
So, yeah. That's basically what it is that I have a very weak digestive system. I have a weak esophagus because it's being crushed by my stomach. Again,
the esophagus problem, that's not my fault. Shut up, you guys.
It is definitely one of the things like that hinder me from.
Just to tell you, when I say it's not my fault, you shouldn't say it is, especially when we're discussing your esophagus. I mean, you're just putting ideas in their head. I'm just saying. But go ahead.
So
I mean, I'll take the credit. It's not true, but I'll take the credit.
So with that being said, that's why I was in the hospital this week. Well, at least that's one of the reasons why I was in the hospital this week. is because I had to go for the initial meeting for them to tell me that they're going to send me on an endoscopy. And then I had to go back again for the endoscopy. But then there was also another time this week that I was in the hospital, and that really had nothing to do with my sickness. Pretty much what it was is I was at work, and I work with kids, and we were doing a relay race. And I consider myself like a very active caregiver, nanny, babysitter, counselor, if you will. Like, I don't just sit there and tell the kids what to do. I get into the game too with the kids. So I was basically running, and the sidewalk was cracked up. The sidewalk was on crack, and I basically lost my footing and I fell. But when I fell flat. Like, I basically did the Superman. It was like whoosh, boom, and I landed on my stomach and my arm and my knees.
Panda!
We got a cat for adoption, y'all. So I basically fell and I had to go to the hospital because my wrist is on the shaky side. And I'm supposed to have it wrapped up right now, but I don't.
I.e. the wrap.
And I was having severe pains in my stomach because I fell on it, and like, seeing as how I had an endoscopy planned, I wanted to make sure like I could still do that. So went to the hospital, got all poked up, got checked out,
Missed a couple veins,
x-rays,
had to call somebody else. She had one of the nurses had to wait for somebody else to come out the room. X-rays,
CAT scans, all that mumbo.
Wait, why'd you need a CAT scan?
Oh, they had a CAT scan in my stomach.
You can't. A CAT scan is for your head. It's just their way of saying you got a big ass head. They just assume you fell on it too? That's fucked up.
They CAT scanned my stomach.
No, that's just a regular x-ray.
No, they CAT scanned my stomach.
Whatever.
So, yeah, they did all that mumbo jumbo. And on the bright side, my stomach couldn't get any worse than what it is. On the downside, I have low blood pressure. So that explains all the headaches and the dizziness that I've been feeling for the past couple of days. Also, fun fact, I had another doctor's appointment. I now got to sleep with a
mouth guard.
Because my teeth are fucked up. No, not because my teeth are fucked up, but because
she boxes in her sleep. She got skills when she sleep. When she sleepwalks, she got those hands.
I don't even sleepwalk.
James was my mouth guard. You just go back to bed. I'm gonna whoop this bitch's ass. Come here. You was talking all that good shit on Facebook, right, bitch? Come here. Yeah. Bitch. This ass whooping ain't over here. James, get me some water.
So, yeah, like, I basically fell, busted my ass at work, had to go to the hospital to make sure everything was okay. And, you know, outside of some low blood pressure, a few sprains, bruises here and there, I was good to go for the endoscopy on Monday. So, yeah, I mean, that's pretty much what that story time is. Like, I have hiatal hernia. I don't know what they're going to do as far as if I'm going to have surgery or not. I know that it's 8 centimeters. I know that it can get bigger. I know they considered it to be medium size now. So I have to wait for a biopsy because they took tissues from my stomach or whatever to basically test it.
Now, there's multiple aspects of surgery that she can get. It's just subjective to her body type and what they agree to and allow. But some have more complications than others, obviously, but... Hey.
We do not know if I am having surgery right now. So before everybody like starts
oh my god, you're no.
Before
it may not be that serious. It may not be.
Before everybody starts treating me like a patient here.
But worst case scenario, that could happen.
Before everybody starts treating me like a patient and trying to cut me out of life.
Hold on. What if they donate money? Oh, I shouldn't have said it on camera, huh? Shit. Hold on, pretend I didn't say that, you guys. My bad.
Like I said, before all that happens, we do not know if it is going to lead to surgery.
No, but it's doubtful because she is making a recovery. It's a slow process, but she's doing better than she was. Well, according to the doctors.
No, it's just that my esophagus is no longer inflamed.
Which is a good thing. So that means you are making progress.
That's how they were finally able to figure out the problem's hiatal hernia. Because once the esophagus stopped being inflamed, they was like, oh, look, there goes what's been causing the problem. Mm-hmm. So
progress is being made. So hopefully surgery won't be an option.
However, it is a well-known fact that being overweight is one of the it's one of the reasons why I'm having the issues that I'm having as far as my digestive system. And if anybody knows me, that I've obviously been on a weight loss journey where I would go to the gym and then stop, go to the gym and then stop, go to the gym and then stop. And a lot of that had to do with just me being sick, not because I didn't want to go or I was ready to quit because I wasn't seeing any type of progress, because, I was. And when I saw the progress, I was flaunting it every damn chance I got. Honey, let me tell you. But a lot of it basically had to do with just me always being sick at the gym, vomiting at the gym, being too tired to work out because I just spent an hour at the gym throwing up. So that's why my weight loss journey has been on and off. And if the doctors decide that they do not want to do surgery for the hiatal hernia, I think that I am going to look into weight loss surgery. I do understand, that's going to be a huge life change for me. I'm going to have to change my lifestyle a lot. Not really 100% sure if I'm ready for all that, but I am definitely considering weight loss surgery because of the medical issue. If I was just overweight and I did not have any medical issues that hindered me from working out or being in the gym the way I would love to be in the gym, trust me, I would just be in the gym and just lose the weight. But unfortunately, with me gaining the weight, I basically developed hiatal hernia. And it has a lot of effects because pretty much any pressure on the stomach could lead to me,
offset everything.
Could just lead to me being sick. So me doing push-ups, sit-ups, lifting weights, being on the treadmill, things like that. Believe it or not, even though those machines are made to work out your arms or your legs or something, you're still putting pressure on your stomach anytime you basically bend down. So like I said, those things like that, if I didn't have hiatal hernia, I would definitely just be in the gym losing the weight. But I have hiatal hernia. It does affect my workouts. It does affect my eating. Sometimes I could drink water and vomit. Sometimes I could drink tea with no milk and vomit. As a matter of fact, I don't even drink milk. We do almond milk over here. We're dairy free pretty much for the most part, except
eggs and cheese.
Yeah, pretty much except eggs and cheese.
Why'd you say X? Except,
that's what I'm going to say. So, except eggs and cheese. That's about it.
And yogurt. Well,
actually, no. I have a non-dairy yogurt that I like.
Technically,
Team Kite Hill.
I can't say that. I loves me some Greek yogurt, especially with peaches.
So, with that being said, guys, that is why I've been in and out of the hospital for this week. I have hiatal hernia, and I also got to sleep with a mouth guard. And that's about it. That kind of wraps it up. But I just thought that I would give you guys a heads up on why we might not post all the time, or if we do a video and I just might be sitting there in the video it's not because I don't know how to socialize. It's not because I don't want to do the video. I really, really do. But
she's in the process of recovering, or in the process of about to being thrown up.
Either I'm about to vomit and I'm trying to hold it in because I want to do the video,
or she's recovering,
or I'm recovering from it, or I'm literally running on 2 to 3 hours of sleep because of it, or I'm just sitting in pain because sometimes my stomach will just be really, really burning and I won't have to throw up, but it will just be on fire.
But no matter what, she'll be okay. But thank you guys for the support.
But thank you guys for watching. And thank you guys for listening. And now you guys know why I've been in and out of the hospital. That pretty much was the story time.
And let's tell them, a family that locks together
stays together.
But most importantly,
dies together.
Mm-hmm.